It's only been 1 month since the new coronavirus global outbreak was declared. Since then, there are many more new cases, many more countries with confirmed cases, and more information available about the illness itself. The number one question, though, still is, how does COVID-19 spread? What is known at this time is that the virus is spread primarily from person to person, very similar to how the flu virus spreads. When an infected person coughs or sneezes and sprays the infected droplets into the air, these droplets can land on another person's mouth or nose and even be inhaled from the air, spreading the virus. COVID-19 may also spread through infected surfaces. This happens when the infected droplets are deposited on surfaces and people come in contact with it shortly after, and then they touch their mouth, nose, or possibly their eyes, and they can get infected too. The latest studies are showing that even people who don't have symptoms, in other words, they're asymptomatic, can spread the COVID-19. This is why the message from health experts across the globe is the same, that everyone should be focused on prevention.
The key message is prevention.
And that universal prevention message is as basic as it can get.
Getting rid of your rags and using tissue if needed, or sneezing into your, or coughing into your arm or forearm, hand washing. Many of us just wash for 1 second, 2 seconds. It should be at least 20 seconds of proper hand washing. Not sharing foods and drinks, and especially if you're ill. And trying to not touch your face and touch your mouth and nose regularly especially when you are exposed to somebody who is ill.
Hand washing to prevent a global outbreak? Yes. Globally, we don't wash our hands enough or correctly. Proper hand washing includes soap, clean water, at least 20 seconds of lathering, and a clean towel or paper to dry your hands. This practice should be done frequently throughout the day. The other critical practice is properly covering your mouth when you sneeze or cough. Not with your hands, not with a reusable rag, but in the bend of your elbow or tissue that you will throw away right after. This simple change in habit can limit the spread of many viruses. And what about using a surgical mask?
But when we talk about regular face mask and its benefits and use, people do use it and feel that it's effective, and there is some limitation to how effective it is for prevention of significant viruses. We do know that after it's become moist and wet from saliva, everything else, the protection reduces significantly. Using the face mask isn't something that the Ministry of Health or that at Central Health Region we're recommended for everybody to wear, just because of its limited efficacy after using it for an hour or two. Yeah. The one thing it might do, it might help you not put your hands to your face or something like that. But besides that, we can say, okay, that is definitely the gear that will prevent you from getting this
So maybe
infection.
A false sense of comfort.
Yes, absolutely.
If you do feel safer using a mask, remember that the effectiveness is tied to the type of mask and whether it's used correctly. Nonetheless, a mask alone won't keep you in the clear, as all experts agree that the best line of defense against any virus is still hand washing. That is, frequent and proper hand washing.